Welcome back, and we are joined now by Dr. Timothy Jochen, a local dermatologist. And we're here to talk today about National Eczema Month, which is the month of October. We usually associate the month of October with Halloween and temperatures falling, but this is truly a serious condition, a skin condition that affects what? Over 31 million Americans. But first, Doc, what exactly is eczema?
Well, eczema is inflammation of the skin, and it's important for three reasons. First of all, it's very itchy, and some people say itch is worse than pain, and so people go crazy with this condition. Some people will even go to the emergency room because they're suffering with it. Number two, it looks like a rash, and so my patients really are worried about what other people will think. You know, a lot of people are afraid that people will think they're contagious, so they're afraid to go to the pool, they're afraid to go to school.
Well, what causes it?
Well, it's inherited, and so you're genetically predisposed to getting this condition. Most people get it when they're young, and it gets less severe as you get older. However, it does predispose you to having sensitive skin for the rest of your life.
You do have sensitive skin? Is that what you said, for the rest of your life because of this? But it's something that is hereditary?
Well, you inherit it, and most people show the signs early on in their life, but it will become less severe in most people over time. However, my population tends to be a little bit older because of where we live, and they still can suffer very severely from this condition.
What are the early signs?
Well, your skin will look red and scaly. Oftentimes you'll get little water blisters, and because of this disruption in your barrier, you can also get secondary infections like fungal infections, bacterial infections, and viral infections. If you have it, most people will know, though, because you'll have these red, scaly spots that itch like crazy.
And how do you, as a doctor, determine that it's not just poison ivy or something along those lines that some parent may just overlook completely?
Well, you know, it's one of those conditions where it's pretty easy as a dermatologist to differentiate this from things like contact dermatitis, for example, poison ivy, just by the classic presentation of it. You know, it looks like red, scaly patches with some water blisters in it. So for dermatologists, it's like identifying what different flowers are like. Okay,
now you said that it's not contagious, but there are treatments for it, right? Without a cure, there are things that will keep it basically without any problems for a while, keeping it under control. What are those treatments?
Well, you know, a lot of people will try over-the-counter medications, and when those don't work, like the over-the-counter hydrocortisone, they come to see me. Now, the first things we want to start with are a good skincare regimen, and that means using a gentle cleanser that doesn't irritate your skin and dry it out. Number two, finding a really good moisturizer. Again, not a perfumey one or anything that's going to irritate your skin. And then finally, we can do things like topical steroids, but we also have new treatments out there that don't thin your skin like the topical steroids, and these would be Protopic and Elidil, so they're great for calming down the inflammation without thinning your skin.
Okay, the best advice, though, doctor, is to come see a dermatologist like yourself and get the right diagnosis right off the bat.
That's correct. Thank you.
Thank you, Dr. Timothy Jochen there.